everybody. Thanks for joining me and my friends for some Lack Talk.
Oh,
I'm
oh.
Jade, and today we'll be talking about the flip side of breastfeeding.
Yes, my name is Tayshawn Walters. I'm a certified lactation counselor, and I'm also going to be a doula very soon, which I'm super excited about. And I'm on the path to becoming an IBCLC. And I have a very passionate heart of the maternal and child health world. And so excited to be here.
Hi, everyone. I am Mariah. I am a stay-at-home mom, online business owner, and I just really have a passion for helping women who were a bit misled in their journey of breastfeeding and postpartum and all things motherhood after the baby. So I'm really excited to be here and have this chit chat with you guys.
And I'm Rosalind. I am a breastfeeding peer counselor with WIC. I am working on my certification to become a lactation counselor, and I'm on my way to becoming an IBCLC, and I'm a doula.
I love the and I'm a doula. I am Jade. I am soon to be an IBCLC, waiting on my test results, fingers crossed. And also a doula and a perinatal health worker with Birthmark Doula Collective and New Orleans Breastfeeding Center. So happy to be here and to be having this conversation. So I want to know, you guys, like, what are some misconceptions that y'all had about breastfeeding before actually experiencing breastfeeding yourself or getting formal education about breastfeeding?
I'll go first. I think the first one was that it's like supernatural, and it'll just come to you and you'll just know how to do it. The baby will know how to do it. And then the second one would be like that it's just all sugar. Like it's just great. Like this is what your baby needs. This is all that they need. And if they don't get breast milk, like it's the end of the world because breast milk is the only way to be fed. That's where they get all their nutrients. That's the only thing that can keep your baby healthy. So those were like the top two things that freaked me out and were like huge misconceptions once I actually experienced it for myself.
And so I'll piggyback off of her. I took a breastfeeding education class when I was pregnant, me and my husband. And it just kind of seemed like, breastfeeding is going to be easy. Like they showed you, how to do it and all of this stuff. So I was thinking, it's going to be a breeze. And it totally was not. It was very hard. But we made it through. Yeah.
Definitely. I think for me, since I'm not a mother, I don't have that experience as a breastfeeding, but I will say prior to really getting into breastfeeding and lactation, I think it was just a common misconception of what it even really looks like and how it can change the mom's total life and outlook on things and that relationship between mom and baby, just so many different dynamics in lactation. So it was just like an eye-opening experience of me being able to learn about that and learning that moms, really do struggle and sometimes they don't really talk about it. So it was just, I think, an eye-opener for me to learn in that way for sure.
Yeah, I think for me it was more like the pressure of it all, especially around whatever my decision was, right? Like I didn't feel like I was entitled to have a decision. I had to do whatever everybody else was doing or whatever worked for everybody else. So like I didn't want to pump. And I kept like, oh, you need to pump and you need to save milk. And I was like, well, I don't want to do that. Versus like somebody like Mariah, and I'll let you kind of tell a little bit more of your story, Mariah, where, pumping was the way that you fed your baby because you didn't get proper support during the beginning and the first time. And so there's such a wide range of where these stories can go, but really tailoring it to what you want your experience to be, not what everybody else thinks that the experience should be. Or, grandma say you need to get that baby off your titty, and, like just all of these different things that come about and become a part of the conversation, especially in those beginning time frames where you really don't know what the hell you're doing. you're learning breastfeeding is learning a skill set like any other skill set. So if you're learning to drive a car, you're not going to get in the car and be like, oh, driving is natural, let me just get in here and pull off, and oop, ran into this tree, guess that didn't work out. Or like riding a bike, and you're not going to be like, oh, I know how to do this bike riding thing, I was made for this. And then you get on and you're on the sidewalk with a busted knee, because it's all a skill set. You have to learn what to do, how to do it. Is it a natural thing? Yes, right? But that does not mean that it does not need support and education, and living in a house might be natural. But if I'm going to keep it up and I'm going to buy one, I still have to educate myself on what this process looks like.
Yeah, definitely. I
And I
think,
feel like even in the hospitals, I'm sorry to cut you off,
no, go ahead.
but even with the lactation support in the hospitals, I still did not feel equipped when I left. Like I swear to you, I panicked when we got back to the house, because I actually had a scheduled home birth and it didn't go as planned. So we had to get transferred to the hospital. And after leaving and coming back home, like our house was chaotic from the home birth and everything. And you kind of have like a setup that they teach you in the hospital beds. So no, I'm at home. I don't have a hospital bed. I just had a crying baby ready to feed, and it was chaotic, and I didn't feel like I got any tools that I can take back home with me. And it was, oh my God, from there.
Yeah,
And I love that you said that. I feel like it's the perfect segue to Mariah's story.
perfect, like spot on. I had a very traumatic initial, like 2, maybe 3 weeks of trying to breastfeed. So obviously, like I had my son, I had to be induced, because he just, you know how kids are, they don't follow directions. So I had to be induced. And of course, they bring in the lactation consultant to like show you all of these things. Well, the first thing that happened for me, which was really, I don't know, this was kind of like the turning point of my whole experience, because the woman specifically said to me, the baby right now just needs like colostrum, like that's it. Like just, and at that point in time, I had no idea what that was. I was like, okay, colostrum, sure, that's what the baby needs. And they're like, they just need a little bit. Their stomachs are like this big, it's fine, they don't need a lot. And so here I am thinking like, okay, they don't need a lot. So like, we just gonna, whatever. Like, I wasn't thinking like I had to be doing this at a certain time. No one told me. They would just randomly come into my room and tell me, oh, it's time to feed the baby. And I'm like, is that kind of what I'm going to be doing at home? Like, oh, it's time to feed the baby. Like, is there not a schedule? Like, am I not doing this every so often? And then in my mind, I'm thinking, oh, the baby's stomach is so little, I don't have to do this for a long time. So then I try to latch the baby. I don't really know if you can feel it, because again, like I didn't really have a breastfeeding experience. Like I don't really know if he was ever eating at any point in time. And so in my mind, I'm like, oh, he got it. Great. It's just a little bit. And then I put him back down, and my son, he lost 5 pounds after us leaving the hospital because he was not eating. My pediatrician told us that he was in like a red zone, like a danger zone. He was in the possibility of like losing oxygen because like to his brain, because he wasn't eating. Because again, they told me like he only needs a little bit, his stomach's not that big. And no one came in and was like, hey, hold the baby like this, see if he's latching, like no one. And the person that did end up trying to show me, she won. My son's like screaming bloody murder because he's hungry. At that point, I didn't know why. I just thought babies cried for whatever. And he was hungry, and she was like, oh, let's put him on your boob, whatever. So she grabs his head and she just like shoves him into my breast. And I'm like, is this what I'm supposed to be doing? He's screaming. He's obviously not eating. And this is not something that's exciting for him. I'm a new mom, still in the hospital bed, maybe like 16 hours out of having a baby. And that was really traumatic. It's like, you're not going to explain to me or walk step by step of what we're doing and what it should look like, how I should be holding him. You're going to take his head and just shove him into my boob. Like, that's it. That's the lesson. And there was 2 other lactation consultants that came in over like my 3-day stay. And they were just like, how are you doing? And in my mind, just shoving the baby's boob, I'm like, I'm doing great. I'm doing what the lady did earlier. Like, I'm just shoving his face and hoping that he gets something. And so obviously, like, now that you know that he went to the pediatrician and lost all that weight, that was very traumatic, because as a mom, I felt like I failed my son, like straight out the gate. I'm like, he's not eating. Like, that was like my only job at this point, was to feed him. I wasn't able to feed him. No one equipped me to feed him. So now I'm going home. My son's lost weight. We left on a Saturday. I didn't go to the pediatrician until Monday. So my son had lost all this weight over the weekend. And I was floored when our pediatrician was like, he was born at, I think it was like 7 pounds. He lost a lot of weight. Like, he just lost weight. And the doctor was like, what are we doing here? Have you been breastfeeding? That was the first thing he asked me. And I'm like, I mean, I thought I was. I obviously not, because he lost all this weight. So he put my son on formula. He's like, we have to get his weight up. Like, that was the end of the discussion. There was no like, let's figure out how to breastfeed. Let's bring in someone to your home. His main concern, and then my whole plan of breastfeeding and doing all of that went out the window, because I was like, at this point, I don't care. Like, I want my son to be fed. I want him to be healthy. I don't want him to be in this dangerous situation. And so my initial welcoming to motherhood was like, I failed my kid. I can't breastfeed. Then I got my pump and I was pumping, and that was great. I was like really excited. I'm like, oh, look, I got milk. This is so much fun. Put it in a bottle. And then the wave of that's not breastfeeding comes in. You know, there's like the people that are like, you're not breastfeeding, like that's pumping, that's not exclusively breastfeeding. You know, like it's a club of like, we put our babies on our chest, and that makes you feel like less of a mom. And also, because my milk hadn't fully come in, I was still supplementing with formula. So then there's the first misconception that I had is like, if you're not using breast milk, your baby's not getting what he needs. So in the back of my mind, I'm like, couldn't feed him with my own breast milk, so he lost all this weight. Now I'm giving formula, and I don't even know if that's all that he needs or the nutrition that he needs. So he's getting formula at night, breast milk during the day. And now I'm overfeeding him, because in the back of my mind, all I'm thinking about is all this weight he's lost. So now I'm overfeeding him. Now I'm giving him too much formula and too much breast milk on top of it. So it was like a whole thing for me. And I finally figured out, like, my sister is Tay, and she was telling me like, come on, Mariah, like join the breastfeeding support group. And I'm like, I don't want to be a part of anybody's group. I'm done with the support. I thought I had support at the hospital. I'm done. I got on there, and I did, when I initially came to the group, I felt a little like shame, because like all these women are like, oh, I've been breastfeeding for like 6 months and 7 months. And here I am. I'm like, I'm hooked up to a machine. Like, that's what's happening to me. And nobody else was really pumping. And so I felt like I was just kind of in limbo, right? Like, you don't really fit in with the formula feeding moms. You don't really fit in with the breastfeeding moms, because you're doing both. Like, you're giving breast milk, but it's not like mouth to boob or whatever. And then you're not like fully giving formula, because it's only the night bottle. And it was like a very scary time for me, because I'm just like, I really have no idea what I'm doing, and no one told me. And then I get in the breastfeeding support group, and then I get all this information, and now I'm like, well, it would have been nice to have one of you or somebody at the hospital with me to like advocate, like, hey, she's not feeling supported. The last day I left the hospital, a lactation consultant came in. I'm assuming that's like their thing, to like come in the last day of your stay to see how you're doing or whatever. She comes in, and I will never forget this. The only thing she asked me was, how are you mentally? And I was just like, I don't really know how to answer that question. Like, I don't know what it is that you're looking for me to say, because I don't even know what I'm supposed to be doing. Like, there was like no instruction. So I'm not sure how to feel, because I don't know if I'm even doing what I'm supposed to be doing. And she was like, well, let's see you, let's see you feed him before you go. And I put him on my boob the same way the other lady told me. I just shoved his face on there. She's like, how does that feel? Well, I don't know. Like, I don't know how it's supposed to feel. Like, what is it supposed to feel like? Is it supposed to feel like he's biting me? Is it supposed to feel like he's sucking? Like, I don't know what it's supposed to feel like. In my mind, I'm like, milk must be dripping out. He seems fine. I don't know. And she was like, oh, that looks fine. That looks great. You holding him right. Like there was no like adjustment happening. She's sitting across from me and just like, it looks fine. Everything looks great. And I'm like, perfect. Then I'm going home and, we'll just keep doing that. I didn't realize there was different positions to hold your baby in the breastfeed. I didn't realize like there's a certain way you hold their head to latch on. I didn't know any of this stuff. So my experience was really, really awful. And I think a lot of women have those experiences and they don't talk about it. They just go straight to formula because they kind of end up feeling the way I was feeling, like you just failed as a mom, like you just couldn't breastfeed. I know the conversation I had with my mom, it was very straightforward, which was, you guys just didn't latch. Like that was it. And for her, that was the end. She was like, y'all didn't latch, so I didn't breastfeed. When like, I feel like now looking at my situation and hearing hers, I feel like if she would have had someone like a support group or a consultant or somebody come to her house, she could have probably breastfed us longer, because it's not necessarily you just won't latch. Like maybe you weren't holding the baby right, or maybe, whatever the case is, whatever the issue could have been, like I feel like it could have been resolved if the right people were put in place to help moms actually breastfeed their kids. We wouldn't have so many people having so many struggles with breastfeeding if there were people actually educating these women, these moms, on how to do it properly and how to, keep going. Because
And
it's hard.
I want to normalize the struggle, right? The struggle is a part of the process. There's nothing that we do that we've never done before, or even if we've done it before, we don't go to a job and we're like, oh, I've gotten this fancy degree and I know exactly what to do once I get to this place or this job. That's just not the expectation. There's no other area in life that we go into something that we've never done before and expect to not struggle, expect to know exactly what to do, expect to not need support from people who are specialized in the field. And really holding accountability to the lactation professionals that are doing the education, because what are we teaching? How are we? Pumping is still breastfeeding. You are taking milk from your breast and feeding it to your baby, right? Like I remember me and you sitting down, Mariah, and me being like, listen, you are no less than anybody else on this call because you are pumping. Actually, you do more work than the rest of us. You do more because I'm lazy. If I had to do what you did, I don't know if I would have made it.
I mean, I only did it for 6 months because that was work. That was a full-time job trying to strap in, and no, that was a lot.
But that was the determination to do what you felt like was best for your baby. And that's still breastfeeding,
Yeah.
right? So really, I feel like the biggest takeaway is always support.
I think a really huge thing is that with society, I feel like because it's breastfeeding is, you hear about breastfeeding, but it's not something that most of us grow up seeing. It's not intertwined in society. So it is something that we're all having to learn. And one big takeaway that I took from your story as like, wanting to be a professional is to not assume that every mom knows the basics. That is so scary to think that like, you knew like nothing. I know for me, I had, my story was similar to yours, but I did come with education to it. But my baby lost weight and all of that stuff. And we had, all those struggles. But it really scares me, like hearing that and just, you really think that you're helping and you really think that you're doing something. And to send you home to that kind of devastation is so scary. So I think that's something that all of us as lactation professionals can take away, is to don't assume that they know the basics. Like, we're starting from ground zero and, giving it to you and stuff. And even the questions that we're asking, making sure that they are helpful and, letting mom talk about what you're experiencing and stuff, and not just, what we know.
Yeah, I remember one of the nurses, she came in the room and I broke down crying because she's like, you know, he needs to eat. Like, again, they were just like kind of sporadically telling me like when the baby needs to eat. Like, I was unaware like what the cry is for, you know, eating or whatever. Because I was sick majority of my pregnancy. So I was unable to really leave my house and go to classes and do stuff like that. I was literally starting at ground zero. Like, I know nothing. And she came in and she's like, okay, I think it was like around like 10 o'clock at night. She comes in and she's like, okay, I think it's time to try and feed the baby again. So I just looked at her and I'm like, please just feed him. Like, and I'm just like crying because I'm like, whatever I'm supposed to be doing, like, it's not working. And I told her that. I verbally said that. She was like, I'll have the lactation consultant come by, just try to breastfeed him again. I'm like, just give him formula, just feed my son. Like, he's crying, I'm crying, like nothing is happening. My husband looks at me and he's like furious because he can see how upset I am. I'm like, I don't know what I'm doing and no one's helping me. Like, literally, like no one. And I knew at that point, I was like, I may not know anything about breastfeeding, but I know that this is not what it's supposed to feel like. I was like, there's no way in the world that I'm supposed to be sobbing, my son's screaming bloody murder because he's hungry, obviously. And like this little colostrum thing that you're talking about, his small stomach that you're talking about, like that is not, it just, to me, the logic just wasn't there. I'm like, there's just no way whatever I'm doing is feeding him. So instead of you telling me to just put him on my boob and we don't even know if he's eating, how about you give him something?
Right.
So
and then educating you to know this is what eating sounds like. This is what it looks like.
Yeah.
What these cues are. This is what, you know.
And there was none of that.
Really having lactation consultants that look like us is important because I can't relate to you. I want to. I wish I could. I don't.
And
right?
like, the only Black woman that was in that whole experience was my midwife, and she delivered my son. But she delivered my son, and then an hour later, she was off. Like, she went off work or whatever, she clocked out. And she didn't come back until Saturday. I had Duke on a Thursday morning. She didn't come back until Saturday. So I didn't see her. Like, I didn't see her, and I didn't see anybody that looked like her to come and assist me. When I left, she talked to me for like an hour before I left. Like, we were already discharged, and she was like, I'm so glad I caught you before you left. And she walked me through like the me side of things, like what's going to happen postpartum, my 6-week checkup. Like, she walked me through everything about myself, because I'm assuming she assumed that the lactation consultant walked me through everything about the baby, or that the pediatrician that was in the hospital walked me through everything with the baby. But that was not the case. Like, I only went home knowing about my 2nd-degree tear, you know, all of my stuff that she walked me through, that she did after I delivered Duke. But I didn't know anything about Duke. I didn't know what I was supposed to do when I got home. Like, it was literally the only thing that I did learn in the hospital was, I don't know the proper term for it, but like you do it yourself. What is it called? Hand expression.
And express it.
Yeah, that's the one thing they did teach me, to get the colostrum to give to him. But again, it goes back to them saying he doesn't eat a lot. And so I thought me squeezing out like a little droplet was the end of that. They didn't tell me how, you know, like they don't tell you how much your baby should be eating. They literally said like, he doesn't eat a lot, his stomach's this big. So in my mind, I'm like, he doesn't eat a lot, his stomach's this big. So I give him a little.
I'm sorry to cut you off, but I think as our society moves toward, you know, all this breastfeeding promotion and stuff, it is so important for everyone who comes in contact with new mom to have lactation education. Because honestly, I think when I was in a hospital, I got so many different opinions from people, and they were just opinions. It's not facts. You don't really know, you know, you're just telling me what you think or how you say, like just shoving him on the boob. Even the lactation consultant that I had, I think she was with me for like 4 hours of the total of my stay, but I still didn't learn anything leaving. She was not helpful. It was, oh, well, let's just try this side. Let's try this way. Let's try that. But it still wasn't like, I still didn't know how to do it when I was done. So I think like the proper like lactation education is needed for everyone who comes in contact with a new mom, not just lactation consultant, but all of your nurses, your doctors, everybody should know how to help you. Because I mean, the lactation consultant is only there for a few minutes and then she's gone. But the other time, I'm sure it was your nurses trying to help you get baby on and stuff. And a lot of times they don't have the education to know, oh, that latch is not proper. Oh, your hand is not right. Oh, let's try this and stuff. So yeah, I think that's something that really needs to change. And if we're going to help moms have a good start to breastfeeding, because no mom should ever have to feel like that, on your journey. Yeah.
Yeah, and I think it's just really important for not even just like lactation consultants, but for moms. And I'm saying this from my own experience, because the moment I started crying and I told her to just feed my baby, I found my voice in the hospital. And I think it's very important for moms, because we do know to a certain extent what is not going right. Like, we may not know what is the right thing, but we know what's not the right thing and what doesn't feel right.
And I was going to say that, like, your intuition
Yeah.
kicked in, your mother's instinct kicked in, and you was like, something's not right.
Yeah. And I think it's important for, like you said earlier, Rosalind, for lactation consultants to listen to the mother, for nurses and doctors to listen to the mother, because that's a very vulnerable time. I've never been like fully exposed just in a room with my baby just on my boob. Like, that's never been an experience for me. So then to just have my boob whipped out and then you just like probing on me, I don't even know you, I haven't met you. That's very vulnerable. So then it puts you, yeah. And then that puts you in a weird, like, now I feel uncomfortable. Now I feel intimidated. Now, like, it puts you in a very small space. You just had a baby. You're already feeling whatever it is you're feeling in your body, whatever your hormones are doing. And then to be probed on, and then your baby screaming. And it's a lot of environmental things that are happening outside of the internal things that are happening. And I think it's just really important for moms to use their voice, and then for there to be space for them to use their voice. And allowing the mom to just kind of like feel. And I don't know if it's a thing, but more time with the lactation consultant, I could tell that the people that were coming to visit me were like, get in, get out. I'm on a schedule. I have other moms to visit. And that also doesn't make you want to ask questions, because it almost seems like you're inconveniencing them. My husband can tell you, they were like, all right, well, if that's it, we'll head on out. And I'm like, that's not it. You literally just shoved my son in my, like, I didn't learn anything. Nothing happened. Like, all you did was show me how to hand express, which I did probably once in the hospital and one time before we went to the doctor's office with my son for him to have his checkup. And so I think it's just really important to, take a little bit more time with your people, with your patients, because they need it. Like, it's a very vulnerable time. Like, and if their nurses are the ones that are always in and out, because we know that they are, if their doctors are rarely ever available, I think it's important to have somebody in that room that's going to really walk you through what's happening. I mean, I wish my midwife wasn't off, because I know that she would have kind of shut the show down. Like, look, get her what she needs. And I think moms really need that, especially if their husband's not the person that's going to do it. My husband had no idea about breastfeeding, about anything. Like, he was completely clueless about all things baby related. So it's like he couldn't really speak up and say anything, because he doesn't really know what he's speaking up on. But I think having somebody there to walk you through the entire process of what it looks like in the hospital and then how it changes outside of the hospital, because those are two very different things. Like, yeah, you feel great and whatever in the hospital if you do get that type of support, and then you go home and it's like, I don't have the woman here to show me how to do the football and the cradle and the, the basket and the pillow, and I don't have the person. So I think it's important to have someone like there walking you through every step until you go home. And then I never got a phone call. I've heard people say they got a phone call from their people. I've never gotten a phone call for anything ever. But checking up on you when you leave the hospital. Like, why just send a mom out there on her merry way? Like, it's not very supportive. And a lot of people end their breastfeeding journey at the hospital because they're not equipped to take that home. I think the only reason why I was determined was because of all the pressure that there was around breastfeeding. I mean, even one of my dance coaches was like, you have to do it for a year. So in my mind, I'm like, I have to do this for a year. I have to figure this out. And it was stressful. Like when I was pumping, the best day of my life, and this sounds so bad, was the day I stopped pumping, because it was very hard. Like it was hard to keep that up. And I felt like I disappointed everybody. I had another like mom failure when I stopped. I was like, I failed as a mom. I stopped giving my son breast milk. Now he's on formula. Now I've like killed, a bunch of animals in the Amazon. And that's just how I felt. Like that's how dramatic it was for me. And I think it's just really important to have the support every step of the way, like at every milestone. I know when I was in the breastfeeding support group, like I still ain't got it, Jay, but it's okay. You get your certificate for breastfeeding, like for a certain, like 3 months, 6 months, a year. And I think that really helps you feel like you're doing your job, like you're doing what you're supposed to do to take care of your baby. So yeah.
And it rewards you for like, it sees you. It acknowledges you, right? I feel like when we have babies, so many times, a lot of the care is baby centric, baby focused. And so I feel like the certificate gives you a chance to be seen as you have accomplished something. I love when babies turn like a year or 6 months, and I love saying like not only happy birthday to the baby, but happy birthday to you. You became a whole new person, especially if you're a first time mom, that you will never not be a mom from this moment on.
Yeah.
A parent. You'll never not be this person from this point on. You'll never go back to that old person. And so I really feel like the certificates, and I got you. I'm gonna make you one myself. I'm gonna mail it to you. You're not that far anymore, so I got you.
I know. But I also think it's important for lactation consultants to be a part of the pregnancy journey. Like I think like in the OB's office, there should be a lactation consultant that comes to like your visits with the OB, like to walk you through what's about to happen. Like,
and that's amazing that you say that, because the best time to learn about lactation is during pregnancy, right? Because once the baby's here, then my mind is scattered.
It's too late.
yeah,
I'm too overwhelmed. I have too much on my plate. All I want is my baby fed at this moment.
And so I think it should go back to high school. Like, how we would do like the sex ed classes and stuff. I think that's something that not even just girls, but guys need to learn too, so you can support your wife. I think that would be good, so you have kind of that introduction to the basics, at least, so we're not like Mariah coming in with like no knowledge, and then you're not getting support on top of that, and then it ends in failure as well. But I did want to touch back on something that you said, Mariah, about you finding your voice in the hospital. I feel like as Black women, there is a lot of times in those spaces, you feel like you don't have a voice. You don't have the capacity to speak up and to say how you're feeling, to speak on what's going on. You just, okay, yeah, I'm fine. I'm okay. It's okay. And we suffer. So that's something big that I would stress about moms. And I tell my niece just had a baby and stuff. And I'm like, if you feel like something's wrong, say something. Take up space. Take up whatever space that you need, because those people are here for you. Like, don't feel like you're inconveniencing anyone, or take up suffering upon yourself to so someone else can be convenienced. Like, no, you're there, you're paying for it. Take up your space. You deserve it. Your baby deserves it. So
yeah, I think I lost my voice during my pregnancy because I was so sick, and my husband went with me to every single appointment, and he was kind of my advocate because I was so frail. I lost 30 pounds during my pregnancy because I was so sick. I had hyperemesis. It was just not a great time for me. So every doctor's appointment, I had no energy to sit here and fight with these people. They're like, oh, take Zofran. Oh, here's whatever. Like, how did it feel last time when you took that? And it's like, I went to sleep. That's what the medicine does. It puts you to sleep. So no, I didn't throw up because I was napping.
Wow.
But it was just like a really awful time. So I never really had the energy to sit here and like go back and forth with these doctors or whatever. So my husband would have to kind of speak on my behalf. So then when it comes to like, you know, showtime and it's time to talk about all the things, I'm just like, I'm back in that little like mute, quiet space because I'm like, I didn't have to do this when I was pregnant. Like there was somebody there, but like this is a whole new ball game that he's not really prepared for. So he can't really advocate. So now people are just telling me how I'm supposed to feel and telling me what it's supposed to feel like, but I don't feel any of these things and I don't know how to communicate that. And the only reason why I said something was because I was absolutely fed up. I was like, no, my son is crying. But I feel like that was like a hormone that was like coming back to me after I had my baby. Cause I was like, look, ma'am, if you come in here one more time and tell me to feed this little boy, we're going to have a problem because there is no milk coming out. Okay. I don't know what you're talking about. He's hungry. I'm tired. You keep coming in here to take our blood pressure and our temperature. No one's helping me feed this baby. So go get him some formula. And she was like, we just want to stick. And that's another thing. I'm glad I said that. That's another thing. Sticking to whatever I wrote on that paper, please be flexible with me because I don't really know what I wrote on that paper when I got here. Like that was nerves. That's
You talking about your birth plan?
Yes. Because on there I said just breast milk, like no formula. And when I told her, I was like, just feed my son. She was like, but your paper said breast. And I'm just like, I'm telling you, this is not like my husband saying give him formula. I am telling you to feed my son, whatever that looks like. And she was, but are you sure? Like questioning. So then it puts me back in a space of like, I can't talk. I can't advocate for myself because now you're like badgering me about what I put on a piece of paper 4 days ago when I was not in this situation, when there was no baby crying, when I wasn't crying. And that puts you in a place of feeling very small and just like, I guess I can't go against what I put on a paper. I guess like I can't change my mind.
And so many times that paper is not respected in the opposite sense, right? We have this plan that we've come up with and we've like really put energy. Like I studied for a really long time to come up with my birth plan. Mine wasn't like a weeks notice. Mine was like 2 months ahead of time. Like, okay, at a doctor's appointment, let's go over this. This is what I would like to see. And I still was flexible within my birth plan, but it was something like these were things that were near and dear to me. And so a lot of times we see those birth plans, especially for Black women, disregarded. So it's interesting to hear you had the opposite experience, but with something that could be shifted more flexibly. You know, like I can say I don't want any inductions, but I get pressured to get an induction, and that's not respected. But then I can say I want formula because I feel like my baby's not eating, or just like help me, right? If I hear somebody say that they need formula, I'm not gonna disregard that, but that also lets me know that they need help.
Right.
That's what I'm hearing, right? Something about this process does not feel certain to me. Something about this process does not feel like I feel confident in what I'm doing. Help me.
Yeah. I think like it just needs to be a lot of, I don't know. I feel like maybe we should all go take a psychology class and just like, I don't know, maybe just learn about people and behaviors. And because I feel like to a certain regard, you are a therapist in that moment. Like the amount of hormones.
Needs, right?
Yeah, like the amount of hormones that are pumping through my body after I have a baby, and to then have to not only, because you have like your homework for yourself, right? You have to go to the bathroom, you got to wash yourself, you got to do all of the stuff, take care of you. And then you also have to switch your mind to this child that's laying in this crib next to you that like needs milk, that needs their own whatever. And it's like, somebody guide me, like somebody give me like a guide to follow or sit here and show me exactly what to do. I feel like my husband got better treatment than I did. This nurse sat in our room for like an hour showing him how to swaddle Duke. And I was like, I don't care about a swaddle. Who's feeding my son? Like an hour. I have a video of her like, okay, let's unwrap and let's do it again. And I'm like, we're spending all this time on a swap. He's a professional burrito roller, okay, because of this woman. Like, I still to this day have no idea how to latch my son, even if I wanted to. Like, even though I went through the support groups and all that stuff, I still don't have the hands-on experience of doing that. He could swaddle my son right now, no problem, because they took the time to do it. And I feel like if that was the case for moms, and if we took this whole, like, it's natural, it'll come natural, and that about motherhood in general, not even just like breastfeeding, like just like everything coming natural to you. If we took that off, I feel like a lot of moms would feel more comfortable asking questions, because you don't want to feel like you're dumb, like you don't know what you're talking about. Like, you don't want to feel less than, like, if your motherly instincts don't kick in, like if you don't, if you're not this nurturing whatever, you don't want to feel less than, so you don't want to ask questions that make you seem that way. But that goes back to what we were talking about, just like creating that space and like having someone, which ties in with like a therapist, because a therapist will sit and walk you through all of your emotions and whatever's happening. I feel like that needs to tie in too, like somebody to just like really take the time to walk you through what's happening, what you're experiencing.
And I think that's a doula right there. But
Yeah.
again, doulas don't have to have that lactation education. I know when I started, I did not. So that's an important thing, like, having that. But a doula can definitely be that for you to help to walk you through those
Yeah,
things.
but I think that's really important that you said that.
Sorry, Mariah, go ahead.
No, go ahead, Tay.
I was just going to mention that about having a doula, how beneficial it can be for mom and baby, and then
And
having
dad.
that education early on, because we can prevent so many of the things that happen to you, and then like us showing you the other ways that you can feed your baby, like with spoon feeding and cup feeding and syringes and things of that nature, and really learning about the magical hour, that skin to skin, that rooming in, all that really makes a difference on the outcomes of breastfeeding. And so having a doula or lactation support way early on can be so beneficial. So I think getting moms to know about that early on is like really the big thing of like,
Especially in our community.
Yeah.
Yeah, in our community. Because I know when I started to become a doula, it was like 2015, and it was very whitewashed. No, like none of my close friends, nobody were like, what's a doula? Like, what is that? What? And all of the clients that I was servicing were very wealthy white women. So I think and my whole thing was I wanted to bring this knowledge, this education back to my community, to my people, because we need this. We're so used to doing it on our own. We are strong Black women. I can do it by myself. I can take care of myself. But no, we need that support. We need that help. We need that education, especially as we transition from the period of, hospitalization, formula, all of that stuff, going back to the natural way. It's something that has to be learned, because our moms didn't didn't breastfeed, they formula fed. So they don't even know how to pass down that knowledge and wisdom to us. And so I feel like it is really important to have, like you're saying, those education spaces and stuff, but for our people, so that we're comfortable, so that we can speak up, so that we can, say those things that need to be said, ask those questions and those things.
Yeah, but I think it's really important what you said, Rosalind, which is, and even Tay, I think Tay said it too, just like being well versed in all of it. Like, everybody needs to know everything, at least the very basics of what it is that they're doing. And then the other, category. So like, nurses need to know lactation, doulas need to know things that nurses know. Like, everyone needs to kind of like cross educate themselves, so you're never feeling like you're missing information, or you have to wait on somebody, or you have to go get an extra person to put on your team for your birth plan and all of these things. Because I think with my midwife, my only knowledge of a midwife was home births. I was like, that's the only time you have a midwife, is for home births, like she's the one that delivers the baby at your house. I didn't know midwives were available to me at the hospital until my doctor's office was like, oh yeah, the midwives do the natural delivery and the OBs do the C-sections. That was what it was. In my mind, I'm like, oh, okay, cool. Well, this is the midwife I want. And she was Black. And they were like, oh no, like, it just who's ever on call. And I was like, oh no, it needs to be this one. I was like, I need a Black one.
I feel like that really brings up a good topic about knowing your options, right? I need to know what my options are. I need to know about doulas. I need to know about midwives. I need to know about OBs. I need to know about birthing houses. I need to know about birthing centers. I need to know about home births. I need to know about what are my chances of being induced? What is an induction? I need to know, okay, if my baby is not, I'm not unsure of taking milk from my breast, why is formula the first thing we go to? As Tay said, we can spoon feed, we can syringe feed, we can finger feed. There are so many different options. Why is the first form of supplementation formula versus, oh, you know what? Let's find a way to get this milk that your body's making for your baby out and just find a different way to give it to them.
Yeah, that was true.
That was never even brought to you.
I can tell you right now, all of the options that you just said, I had none. There were no options. My doctor's office said we will induce you if you go 41 weeks. That was these are like their stipulations. It was like a contract I signed at my doctor's office. There were no options. I could not opt in to do a home birth or a water birth. That was not an option. I couldn't select my doctors that I wanted to see. It was a revolving doctor's office. So you saw everybody. Their reasoning was so you can get acquainted with all the doctors. Well, I was not comfortable with all of the doctors. So I would try to request when I set my appointments who I wanted to be with. It was a very traumatic experience because it's like, in my mind, I did have options. I wanted to do a home birth before I got pregnant and before I got sick. I was like, oh, I want to have my baby at home. Like, I feel like that's more natural, whatever. And all of those options got completely taken away from me. Like that wasn't a thing. There were no, you pick these people, you can go over a birth plan, whatever. Like there was none of that. By the very grace of God, he gave me the Black midwife on my day of delivery. I saw her, she walked in and I was like, thank you, God. I was like,
something's going right.
I was like, something is going right. I mean, my delivery was wonderful. And it was so much thanks to her because she kind of controlled the ship. She was like, I mean, I was having contractions every 30 seconds. I would have a really big one and then a really small one. And that was even before I was dilated. And she was like, you're going to be tired. Let's give you a morphine shot. She gave me a morphine shot. It wore off because I have a very high pain tolerance. I can feel a lot of things. It wasn't hurting, but she was just like, you're going to be tired. So we need to like slow these down. The morphine was to slow down the contractions. That wore off. And I was like, hey, I'm feeling it again. Do you think I get another shot? The white nurse was like, no, like we only do one dose. Dr. Asatu came in there and she said, give her another one. She asked for another one. It's fine. I was like, see, that's what I need. I need somebody to grab the reins and be like, look, my patient is suffering. I'm telling you it's okay. This is what she needs. We've already looked at her chart. She can handle the dosage, whatever. And that made me feel really comfortable. So my labor and my delivery, flawless. It was the pregnancy and the postpartum. That was like, there's a disconnect here. But it does go to show that having someone that looks like you in the room that knows what they're talking about to advocate for you, it completely, and I mean, don't get me wrong, the white nurses were wonderful. They were nice. They were friendly. They didn't make me feel any different, but it's just like, you're just not getting it. Like whatever it is, you're just not getting it.
That's definitely a disconnect.
Yeah, like there's a disconnect here. And I just think like through the entire process, there should be lactation consultants. There should be doulas at your OB's office, like starting there.
But I even feel like pregnancy is kind of late to learn because it's just so much to learn. Like it's so much stuff that you only have these 9 months to, and then you're in these 9 months and you're having to make these choices on what you want. So you don't even know all of your options because there's so many and stuff. Yeah. So I don't know what needs to happen, but it needs to happen before pregnancy because I feel like it's just kind of too late. Like you're in it and now we got to get breastfeeding, we got to do this. Like me and my husband took a lot of classes, and because I was a doula, I did have that education and stuff, but I still felt like it was just so many choices. Like, are we going to vaccinate? Like, are we going to do, it's just like, and then if you make the wrong choice, or you have these people like, oh, this is bad, don't do that, and then this side, oh, this is bad, and it's a lot. So I think some kind of education before pregnancy is really, really needed.
Yeah, I definitely agree.
One of the takeaways that really sticks out to me, especially with lactation. Like medically, only about 5% of women cannot breastfeed, right? What that says to me is that everybody else is having a disconnect. Everybody else needs support. Everybody else, if this is the choice, and everybody is free to make their own choices, but with the education around what, the things that breastfeeding can do, and the way that it sets you up if that choice is made, then really, really catching these people while they're in that space and supporting them as best as possible.
Yeah.
Um, I feel like
Yeah.
I feel like I would have been much better off. And I feel like I probably wouldn't have struggled postpartum with depression, anxiety, or like the shame and the mom guilt about like not pumping or not, breastfeeding or whatever, if I would have had the support throughout my journey. Yeah.
Well, thank you, ladies, for having this chat with me, and I feel like it was amazing. And if anybody has any questions, please join us for the Q&A shortly. And have a great day. Thanks for joining us, System Lact.